Members of the nursing fraternity gathered at the National Stadium this morning to officially launch We Dare to Care and Nursing Now Grenada. President of the Grenada National Nurses Association, Patricia Strawn, highlights that nurses locally are facing many challenges that must be addressed by policymakers.
Nurses in Grenada are experiencing many challenges, such as contract employment, unfavorable working environment, inadequate patient-staff ratios.
Mrs. Strawn outlined what must be done to ensure that nurses receive a better quality of life.
It will also focus on the needs of nurses, such as call on government to make greater investment in the nursing profession, in nursing education, payment of attractive salary, training for nurses, positive working environments. It also is asking stakeholders to be a part of the campaign.
The Minister of Health, Nicholas Steele, addressed many of the concerns facing the health sector, including those that directly affects the nursing fraternity. He acknowledged that among the many issues is the fact that more and more nurses are leaving the system in search of better job opportunities.
We've lost 45 nurses in Grenada this year alone that have left to go to first world nations. We continue to invest in our nurses, but because we are not a first world nation, we don't have the ability to pay our nurses those same amounts. So I cannot blame our nurses for leaving. At the same time, we have to engage in a conversation with first world nations to make sure that universal health coverage for all is dealt with, not with them taking the nurses that we have trained and the nurses that have gained tremendous experience here, but for us working all together.
Minister Steele noted that government is taking steps to improve the condition of nurses.
In the ministry, we have invested significantly. We have partnered with other institutions like SGU to make sure that education occurs. We are about to start in January the training of 50 nursing assistants as well. We are looking at all various ways within our means to give as much as possible to the nurses, but at the same time, we have challenges.
Among speakers presenting at this morning's lunch was board member of the Commonwealth Nurses and Midwives Federation, Rosemary Josie. The Nursing Now campaign will focus on 5 core areas, ensuring that nurses and midwives have a more prominent voice in health policy making, encouraging greater investment in the nursing workforce, recruiting more nurses into leadership positions, conducting research that helps determine where nurses can have the greatest impact, and the sharing of best nursing practices. Joseph Kador, GBN News.